Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. We've been having a series on autism, and through that series we've been learning a lot about autism and how prevalent it is. That 1 in 68 children are diagnosed now with autism. That is really a shockingly large number of people. We also have learned that 1 in 34 families are raising a child with autism and dealing with this on a day-to-day basis. So that means that anyone that's watching this show really has a vested interest in learning more about autism, because you are going to be experiencing this in some way in your friendship network. And I think that the more we know about this, the more we can play a vital role in the lives of these folks and really help the families that are working with them. So to that point, we're going to be meeting a nursing expert today. We have Dr. Margaret Souders, who is being with us today and telling us her story, and I'll get into that in a minute, but I want to tell you a little bit about Margaret. Margaret is an assistant professor at the University of Pennsylvania School of Nursing. She is also co-directing a very important program that is training other people, other clinicians in the School of Nursing, to be very aware of this disorder and know, again, how to intervene effectively. And she is co-directing this with Dr. Jennifer Pinto-Martin. Margaret is also a pediatric nurse practitioner, and her clinical genetics work is at the Center for Autism Research at the Children's Hospital of Philadelphia. Now, I've heard from some of our other guests that Philadelphia is a hotbed of learning and understanding for autism. So we're very fortunate that we can draw on people like Margaret. And I want to welcome you to our show today, Margaret. It's really a pleasure to have you at our table.
Thank you, Dr. Nancy RN. I love your title.
Thank you.
It's really provoking. And I'm really happy to be with you because you are a nurse. And I am proud to be a nurse. It's a great time for nursing these days. And just wonderful things are happening. And I just invite anybody who's interested in becoming a nurse to really think about that, because it's offered me a lot of joy. And I think it's offered you a lot of joy.
That's true. That's true.
Yeah.
So we definitely agree on that, okay, to get going. Now, when I met Margaret, I asked her about all the things that she's doing, and she's doing a lot, and we could have many other shows about some of the things that she is really accomplishing. But I really wanted to start out with how she got into this world of autism, because this is not something that a lot of healthcare professionals, nurses, physicians, psychologists really get into. It is definitely a subspecialty, but one obviously that we need to grow more people because of the incidence and prevalence of this disorder. So we're going to title our show today, Passionate About Compassion. And Margaret is going to tell you how she found her home in nursing, working with children with autism. And I think it's a fantastic story. So when she started to tell me this story, I said, we've got to make a show for the public, because learning why somebody takes this step and learning what they're doing with that knowledge, I think is very exciting. And for those who are watching who are nurses, physicians, or others in the healthcare field, will learn from Margaret's story and really get some tips that you can use no matter what your practice is. So Margaret, again, being with us, I think, is really a joy, because you work hard, you really work with some very difficult children, some difficult families, but you are still joyful about your work, and I think that really comes through. So tell us, when you started out, you were doing sleep studies, you were doing all kinds of interesting things. How did you finally get involved with children with autism?
I first started working at Children's Hospital, my first job as a registered nurse, and I worked in the intensive care unit. And I took care of children who had long-term chronic lung disease. So then when I became a pediatric nurse practitioner, I really studied how do you care for children and families who have chronic illness, and how do you help them cope across the lifespan, and how do they get strength and courage to they may have a different type of child, or a child with a lot of special needs or a lot of physical needs. And how do you keep motivated to parent them and to promote them and to really promote their quality of life? And so I took a job in a long-term ventilator unit at Children's Seashore House. It was a social worker and a nursing model, and so they really did a very good holistic care. And so one day in the Seashore House, there was a unit called the BioBehavioral Unit, and they cared for 18 children and adolescents with severe problem behavior. And they just had a hard time keeping nurse practitioners to stay in this unit and to care for these children and adolescents. And it was run by psychologists. So one nurse had quit, and the other nurse had called out sick, and they said, "Margaret, would you mind going over to the BioBehavioral Unit and helping out, because they have 18 kids that are admitted, they don't have a nurse practitioner there, and can you go down?" And I said, "Okay, I'll check it out."
Now, first of all, I just want to tell people that just that alone is great, because most nurses don't want to float to another unit.
Yes.
This was like go down for the day, right?
Go down for the day and go see what you can do. So I went down, and to my surprise, the psychologists were inside of this little ante room. And in the room, the child with usually developmental differences, was having bad behavior or difficult behavior, and they were clocking every behavior that they had, and they were really coming up with clever ways to decrease problem behavior and to promote positive behaviors and good behaviors.
Now tell us what you mean by clocking the behaviors. What do you mean by that?
They had a laptop, and every time a child would do a behavior, they would keep track.
Okay.
And so, for instance, there was a little girl who had autism spectrum disorder. She was also blind, and she was hitting her head 450 times in 15 minutes.
Oh my.
And so when I watched them keep track of how many times she hit her head and what they were doing, I was amazed. And then they said, your job would be to go in there and do a physical exam and check her head and make sure she's okay, because we don't know if we should really continue our behavior strategies of trying to decrease problem behavior and increase behavior where she doesn't hit her head. And so I was like, wow. So then I was able to go into the rooms and do physical exams, even though these children can be very aggressive and they had a lot of tantrums and they were flailing, because I have a 2nd degree black belt in Shotokan karate.
Did they know that when they asked you to go over to the unit?
They didn't know. So I went.
So you flashed, okay, so I'm totally qualified for this.
So I went down, and then I was like amazed that I felt comfortable in the rooms and that I could manage myself and do a really thorough physical exam.
I bet, by the way, I mean, really, all kidding aside, I mean, that's a tough assignment. But I bet because you went in and you were calm, the children probably responded to that. They knew that you would be able to take care of yourself.
Yes, and I think that they realized that I just do a little shift away, you know, when they move, and not worry. And then there's behaviors that you do, like you wouldn't put your head forward so they can grab your hair. So there's a body awareness that you have as having a 2nd degree black belt, where you wouldn't do moves on the children, but you would know more about how to keep your own body safe.
Right.
And so I did my day, and then I got through the day, and they're like, wow, you know, you really were helpful here. And then they said, would you be interested in working here? And I said, okay.
Now, I have to ask you, say you were going to leave the children with the lung problems.
Yes.
You decided right on the spot.
I'm like, yes, I think I'm going to do this. I actually started working for somebody who was on maternity leave, and so I knew that that was a temporary situation, and I'm like, no, I think I can do this. So I had a lot of options. I was a well-trained, you know, pediatric nurse, intensive care unit nurse. But this was my first family, so that was the first child I met. But the first family that I admitted to the Seashore House BioBehavioral Unit was a mom, and she had no teeth. And she brought in her son, and I said to her, what happened to your teeth? And she said, my son headbutts me, that he was hitting his head into the ground so severely all day, ongoing, that she actually got underneath her son to protect her son. She loved her son desperately, despite the fact that he was nonverbal and he had significant problem behavior. He had no form of communication. And so she would get under him and protect his head by having it hit her. And she lost her teeth, and then she lost her teeth again. And I absolutely fell in love with her. I fell in love with her and her son. And they said she told me that he had PDD, or a milder form of autism, and I'm thinking, this doesn't seem mild to me.
Right.
This seems severe.
Right.
And then she said, Margaret, listen, I've been doing everything. I took him to the schools, I take him to the doctors, and no one knows what to do. I feel horrible that I have to actually leave my son here in the hospital at Seizure House in the BioBehavioral Unit and leave him here overnight because I cannot take him home anymore. I can't do this anymore. My life is falling apart. I have 2 other sons and a husband, and it's been very, very difficult for me. So that
just shows you
my
the
story.
level of desperation that people that are dealing with this can have.
Yes, and this was 20 years ago. And so I knew that I was well trained from Penn to take care of children with chronic illness, and I just thought that this was so fascinating about the behavior that I felt comfortable taking care of them. But with this boy, it moved on that the mom cried because I was the first person who actually did a thorough physical exam. Because his behavior was so difficult, a lot of times the docs would just say, I can't look in his mouth because he won't let me look in his mouth. He's not opening his mouth. So I figured, well, how am I going to get him to open his mouth so I could take a look? And so she's like, well, he likes, chips, and I know now, today, I might do things differently. But you would really coax and play Simon Says, put your hands on your head, put your hands on your hips, put your arm out, which cuff do you want, if you want to get a blood pressure. Okay, you're opening up your mouth. Okay, let's see. Oh, good job. No, even bigger. And you would reward small approximations of what you would want. And you would really be like a Pied Piper. And it was with the Pied Piper and the fun and the games, I could get a thorough physical exam.
But see, what was so beautiful about this story is that you sort of just knew what to do. It wasn't like you had any particular instruction in how to do this, but you were just very aware. You weren't afraid of this child, which I think is very key in listening to this story. And you were going to just use the same techniques you might use on another child who didn't have autism, but you just maybe used it even more directed in a situation like this.
And more intensely, and then really reinforcing small shaping behaviors that's getting closer and closer, instead of being frustrated where you ask them to open their mouth and they don't open their mouth. But if they just kind of do a little bit, you don't get discouraged. You just say, come on, you could do it even bigger, and model for them. So that was just me really loving children and taking good care of them. I also, worked in the intensive care unit, so I was used to working with families who were really in crisis. And so that training really suited me well. But I think that I learned how I figured out how to have a meaningful practice was the fact that I was just committed, dedicated, and motivated. And I say to nurses that a lot of times you feel like you're not prepared to take care of kids with autism. But if you reflect it within yourself about your training, what you know about children, what you know about families, that if you really want to do it, I'm begging you to do it. I'm begging you to take the extra time in your practice to make something happen when you interface with a person with autism. Because the parents and the caregivers will never forget, and you will learn, and then you will have the courage to do it again, and you will be a role model for other nurses, and you won't say to yourself, you know what, it's just going to make my day harder. You're going to say, this is going to make my day more joyful. So the family that I took care of, that boy, I did a thorough physical exam, and I found some very interesting things. So he had a high roofed mouth, so he had a high palate. He had a low hairline. He had frequent ear infections. He had flat feet. He had low tone. And so I said, I think there's something else going on, not just autism. And so I talked to my attending physicians, and I talked to the genetics docs, and they came and took a good look, and they sent his blood for blood work, and he turned out to have a genetic syndrome called 22q11.2 deletion. And so there I learned, right in that one family, that if I do a good job, that I push, that I don't give up scientifically on what may be happening, and that I work to get a physical exam so that you can discover what's happening, that you can make it just works. It was amazing. Right. And I'm like, wow, it's such a great first case, because it reinforced everything about how I trained, what I was prepared for. I went back to become a pediatric nurse practitioner. I want to take care of kids with chronic illness, and here's a kid that I made a difference right away, because I wanted to do it, and I had support to do it, and
Right.
I did it.
Well, I think that Margaret did break that down for us in terms of what it takes to make that leap of faith, you know, to go from some clinical area that is more defined, more well-known, maybe more accepted, into a whole other unknown field. And she's talking about 20 plus years ago, but we're finding from some of our other presenters, yes, things have changed, have definitely improved, but some of these basics haven't changed. I mean, really doing the right kind of thing, having that physical exam with a very difficult child, that's common, that hasn't changed. So having, I think what you told us is having the curiosity to really look into this, really to really have that self-awareness as a nurse that I can do this and I can do it well, and I can really get some satisfaction out of this. They're very key learning points for anyone that's listening to this show. Mm-hmm. Very important.
I agree, Nancy. I think also when I moved forward, becoming a pediatric nurse practitioner, I think what is asked of you is to become a diagnostician and to become very good at assessment. And so then I had the opportunity with one of my mentors, Dr. Susan Levy. We went out to Chicago and we were trained on a special tool, a gold standard tool on how to diagnose autism spectrum disorder.
Tell us about that. How does that work?
So we would work with individuals with a special type of toy kit, and then you have different types of toys, and then you would try to elicit certain types of skills from individuals with autism spectrum disorder. So with an 18-month-old, you would want them to gesture, wave bye-bye, blow bubbles, feed the baby doll, and maybe have some words. More, mama, up. And so you would really work with them, and you would bring out your bubbles, and you would bring out your little electronic bunny, and you would bring out your little play set, and you would work and interact. And then at the end of a 45-minute interaction, you would take notes as you were doing this, and then you would score this information. And so I was trained along with Dr. Susan Levy to score this with the author Kathy Lord, who actually generated this thing called the Autism Diagnostic Observation Schedule. What was really cool is that I had the opportunity as a nurse practitioner who was working with an attending physician that we would see children together. So I would do the ADOS and she would watch me, and then I would hear her talking to the parents. And we would have this kind of like a dynamic duo where we would do a lot of assessments together. So it was in that, doing those ADOSs again and again for 10 years, it gave me such insight into the diversity of autism.
Right.
And how do you really elicit social skills and communication skills? How do you know if some child has a lot of repetitive behaviors? Doing this in a very structured way where there's a nice scoring system gives you tremendous insight. So I think a lot of other practitioners across the United States, sometimes they feel that it's hard to start that. Oh, I don't have time in my busy practice. How could I do a whole hour interaction in a 2-hour frame? And I would say, just do it. Well, and that from doing it, you don't have, how do you implement something? Just get started and you figure it out from there.
Right.
And not to be afraid to do that.
But in terms of nurses that say are working in many other areas, how could they really use that diagnostic tool set? I mean, is that something that you would be asking nurses to really understand and utilize in the clinical setting? I mean, I'm trying to really understand myself how that would actually work.
So in the certificate program that I co-direct, the first course is about diagnostics and assessment and screening.
Okay.
And so we do go over this ADOS. We also go over some tools that are standardized and validated that don't require that sort of play interaction that are really good tools. But I think if a psychiatric nurse practitioner or a neurology nurse practitioner or a primary care nurse practitioner who wants to say, I think I can add value to a pediatric primary care site if I train on this, and we find that 1 in 68 of our patients that we care for may have some difference.
Right.
Would we be willing, can we negotiate with the insurance companies to have me reimbursed for this kind of skill? And so I think the future is wide open. The opportunities for nurses to say, I want ownership of certain types of diagnostic skills as a nurse practitioner, or as a primary or a nurse to say, you know, what can we do to screen in a primary care site and to take ownership of these skills. These skills are available for all providers. You don't have to have to be a licensed psychologist to gain this knowledge, and to say that the way that the sort of the reimbursement structures are, they, I think, are going to be willing to reimburse nurses to do these types of diagnostics and screening.
That's very interesting. I think what I really find interesting and fascinating about this is how within a pediatric practice, you as a parent could be able to have your child screened much earlier without necessarily going to a whole different group to have that done. I mean, there are pros and cons probably to, you know, different pathways that you can take, but the most important thing is to get some idea if your child has a problem to begin with. And I think what we've heard from other speakers is that it's very hard for some pediatricians to really know if this child has autism or not, and often they're referred out maybe for other diagnostic tests. But you're saying that maybe as practices start to develop, they could be more robust. They could actually offer this as part of the pediatric practice, and at least it would be a beginning of really understanding how to deal with a child more effectively.
Yes, especially the screening. So the screening tools have strong, the word is psychometric properties. That means that they have a good positive predictive value, that 85% of the time, if you have a problem and you fail the screener, it means you may not have autism, but you may have something else. You can have ADHD, you can have anxiety, or you have delay, significant speech language delay, or developmental difference. So you are identifying a child who really needs services.
Right.
And so you're not making a mistake
right.
with this type of screening. So I think nurses can be well trained in screening. And then you have to create that relationship with a parent and to say, I think, you know, your child is scoring at risk. It's similar to like a mammogram. You get a mammogram, it comes back positive. That doesn't mean you have breast cancer. It means you need to move forward with some next steps. And so with this screening, your child looks like there's some risk here. So what can we do together? And so can you call early intervention? Can you get the team to come out? They're going to they're going to do a speech evaluation. They'll do a developmental evaluation. They could do an occupational therapy evaluation. And so let's get the ball started, because we know that if you provide early intervention with your child, that when your brain is so plastic, that experience can shape it and create dendrites to grow and make connections.
Tell us what dendrites are. Not everybody's going to know what that is.
Yeah. So so the neuron has a big sort of nucleus, and then it has an axon, and at the ends of the axon are these fibers that create connection.
I really appreciate that, but I think we have to start at a more elementary level. So this is in the brain. Let's start with that.
Brain.
So this is part of the tissue of the brain and how it develops.
Yes.
And there are changes in the development of a child's brain that has this particular problem. And tell us a little more specifically about what is different for these children.
Well, we're still, as scientists, searching for, you know, why do children get autism? And we don't know in a lot of cases why. In a small amount of cases, maybe 10%, 15%, they have a genetic phenomenon that can be causing the autism. Like, for instance, Down syndrome. Those children are more at risk. Or the child that I talked about earlier with the 22q11.2 deletion with DiGeorge syndrome. They're higher at risk to have risk with autism. But in general, the children's brains communicate through nerves. And these nerves communicate at the ends with these little hair-like follicle sort of strands that communicate. And so we think that if you provide early intervention and really interact in a robust way with your child, and you reinforce behaviors that you would like, that the brain actually can grow and connect. And so there's more connectivity. So we think that the problem with autism, what we're finding out now in terms of the genetics, is there's problems with the way that the end of one nerve, how those receptor sites are made, and so the pre and postsynaptic areas, so the space between one nerve and another nerve is called the synapse. So we think there's a problem with the connectivity. And so the way the ending is made over here and the way these endings are made over here, the way it communicates is different. That's what the genetics is telling us.
But I think, and that's very, very interesting, but what I think the take-home message is that Margaret's trying to get across is that the earlier you are diagnosed, the earlier you can intervene. And these behavioral interventions can really help even the physiology of those tiny microscopic nerve endings to act differently and therefore to get stronger, to really be able to connect better, as she was describing. And that's really our job in really having this show, is really to really give people hope that with people like Margaret and many others, if we can get these earlier diagnostic tests organized and out there and more accepted by people, then I think we've got a better shot at really helping these children, even though we don't know right now what is the causal factor factors.
Factors. And I think it is factors because there's many different types of autisms. It's very we use the word heterogeneic. It can be very different. So you can say I met one child with autism, and that means I met one child with autism, because they can be very different. And so the goal really is to say all treatment plans really should be tailored to the individual person and their family. And every family has a different philosophical underpinning about how they want to raise their child. And they may want different types of treatment and behavior strategies, or speech therapy or occupational therapy. And so there really has to be a negotiation and a dialogue to say how, with what we know in science and what we know in treatment, how do you think we can, fold this out and unravel it so that it can be helpful for you? And then who is going to help you? Because you need help. And so can you recruit people from your extended family? Can you recruit people from your community? Maybe you have a synagogue or a church that's really can be helpful. Maybe your neighbors who on the block also may have somebody with a special needs. And so the goal is to create that dialogue, because it's not a cookie cutter situation. I think a lot of people ask me, can you go and talk to us about how we're going to take care of that kid with autism that comes into the hospital? And I'm like, well, it's so overwhelming because they're so different. And what might work for one child with autism may not work for another child with autism.
Getting back to you, you found your home with this particular issue and problem. And tell us what you feel like you've been able to do with that for your career.
So when I was seeing families in my practice, I realized that one of the important issues that moms and dads would bring up would be, Margaret, I can take care of my kid with autism. I'll take him to his therapies. But if I don't get a good night's sleep, I just can't do it. I'm exhausted. And my kid has horrible sleep problems. They take a long time to fall asleep. They wake up multiple times at night, and then, my goodness, they wake up at 5 o'clock in the morning singing Lion King, and they just wake up the whole house. And I just can't take it. I can't do it anymore. Please help me. And so that was really a frequent dialogue. So I thought, well, if I'm going to go back and get my PhD, people were encouraging me to do that. I was already involved in multiple research studies. I said, okay, let me talk to the people at the School of Nursing. There was a really strong sleep researcher, Terry Weaver, Dr. Terry Weaver, and she said, no, Margaret, sleep is really important. It's critical for your brain development. We're going to find out more and more about it. We don't know enough about it. We haven't really been doing it well. A lot of people in the world now have insomnia, and I think it would be a great thing for your career to marry autism spectrum disorder with a more specific problem, and that if you could get really good at autism, or maybe you are good at autism, but if you can get really good at sleep, it would be really terrific. So that was great advice from one of my mentors, is to really blend those two.
Well, let me just say that whole discussion about sleep disorders with children with autism is probably a show that we're going to explore and have a whole program on that, because there is so much information. But I think in today's show, what we've been able to do with Margaret's help is really to hear about how a person went from going from a very good nurse to a phenomenal nurse by taking on something that was so challenging that most people were running away from, and she was running towards it. I think that alone is to be applauded. And I think that as she found her own home in working with children and families with autism, it's something that we can all learn from, and really, if we're practitioners, we can add to our practice as well. So I think that what we've learned today is that it does take some courage, but there's just so much payback in really taking that next step. So I really want to thank Margaret for being with us again, and I want to thank our listeners. I hope that you've learned something today, something that you can take with you. So remember, with health, all things are possible. Thank you for joining us, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.